Hey everybody, this is Dr. Cummings from Point Loma Nazarene University. And in this video, I want to introduce the idea of antimicrobial agents to you. This is the first video in a multi-part series, so check out the others in this series as well. And here really what I want to do is first introduce the different types of antimicrobial agents that exist, and then we're going to focus in on the antibiotics. And really the gold standard for how we use antibiotics is the Sanford guide. And so I'm going to step out of PowerPoint, open up the Sanford guide, and show you around a little bit there, just to give you a feel for how we make some of these decisions regarding what antimicrobial agents to use. So first of all, understand that antimicrobial agents come in a lot of shapes and sizes, and they have a narrow range to them in general. Right, so antibiotics, what we refer to commonly as antibiotics, are antibacterial agents. You wouldn't use an antibiotic for a fungus. You wouldn't use an antifungal agent for a bacterium. So one of the first things you need to be able to do when someone is presenting with an infection is narrow it down. Do I believe that we're dealing with bacteria? Or is this possibly a fungal infection? Is it maybe mycobacterial? Now, mycobacteria are in fact bacteria, but none of our normal antibiotics are typically going to work. So we have separate categories for the mycobacteria. When you think mycobacteria, think leprosy and think tuberculosis. There are a couple other infections mycobacteria can cause, but those are two of the biggies. Is it possibly a parasite that's causing this? When we say parasite, we're thinking protozoa, and we're thinking helminths, a fancy term for worms. And then finally, is it viral? And unfortunately, we don't have a ton of antiviral agents. There's not a lot we can do, which is why we focus a lot of our vaccine attention on viruses, because once someone has a virus, we usually just have to let the immune system do its work. So we have antibacterial agents, antifungals, antimycobacterials, antiparasitics, and antivirals. And so one of the very first questions you have to address when a patient comes in presenting with signs and symptoms that appear to be infectious as opposed to some other pathology is we've got to decide what category we think it fits into. And often you're going to be able to narrow that down just based on a really good patient history, can't emphasize that enough, and a really thorough head-to-toe exam of your patient. And if you still have questions, you may have to take samples and send them to the lab. But often just those two skills are going to be able to help you narrow it down to one of these 5 categories. The other thing that I want to mention is a good definition. When we talk about antimicrobial agents, we're talking about any chemical that inhibits the growth and metabolism of microbes within or on the surface of a live human being. In other words, these have to be tissue compatible. Right? Bleach might do a great job of killing bacteria, but you're not going to have your patients drink bleach, and you're not going to bleach a wound, right? Because they're not tissue compatible. So antimicrobial agents are almost always tissue compatible to the point of being able to ingest them orally or have them injected into muscle tissue or injected directly into a blood vessel. There are some antimicrobial agents that are limited to topical because of their toxicity, but most are compatible internal to the human body. Now, when we say antibiotic, even though that's a broad, vague term, we're talking about antibacterial agents. In the strictest sense, these are natural compounds that are produced by other microorganisms. When we say antibiotics, technically speaking, these are natural compounds. In reality, we don't typically limit the definition of an antibiotic to just those things that are naturally produced. They can be semi-synthetic, meaning that we took a natural compound like penicillin and we modified it into the laboratory, and now we have amoxicillin, right? We would still call amoxicillin an antibiotic, even though it's not fully natural. And then there's some completely synthetic antibiotics as well, like Cipro, for example, and we would consider that to be an antibiotic as well, even though it's fully synthetic. So in the strictest sense, it means it's natural, it's microbial produced, but realistically, we don't typically apply that portion of the definition. But what's really important is that antibiotic means antibacterial. We're not going to use it for viruses. We're not going to use it for fungi or those other categories we saw on the last slide. Now, the key concept to all these antimicrobial agents is selective toxicity. So first of all, it has to be toxic to the microbes, right? If it's not toxic, what's the point? We're trying to inhibit or kill them somehow. It also needs to be as selective as possible, meaning we want to do as little damage to the host cells as possible and as little damage to the host cells' normal bacterial flora, the normal microbiome, because of all the benefits that that microbiome is providing to that host. So we want it to be as selective as possible for the microbes that we're going after specifically. Okay, let me step out of PowerPoint and I'm going to open the Sanford guide. Now I know that my section has seen the Sanford guide pretty extensively already. I don't think that the Wolburn section has been using it as much, so let me introduce you to this guide. This is a guide that you can get either as a pocket hard copy and carry around with you in your scrubs, or you can have this digital copy. The great thing about the digital copy is they update it every month, which is just fantastic, and I think it's about a $30 annual subscription. I'm not going to show you around the whole thing, but you can see from this cover page, you've got a variety of ways to think about how to choose what antibiotics you're going to use. I just want to go straight to the anti-infectives at this point. That's another word for antimicrobial agents. And you can see antibacterials, antifungals, antimicrobacterial agents, antiparasitics, and then for the viruses, they actually split out antiretroviral from antiviral. And when you learn about viruses here in the next week or so, you're going to see that the retroviruses are a unique group. This includes viruses like HIV. And in fact, that's the predominant retrovirus. So in a sense, that category of antiretroviral agents are going to be mostly anti-HIV drugs, and then regular old antivirals for the handful of viral pathogens that we have. If you go to the antibacterial agents, you can see all these classes of compounds. These are chemical classes that you could choose from. Let's just choose one of them. Let's go with the penicillins because it's one we're all familiar with. And you can see different subclasses chemically. So the aminopenicillin, so it's a penicillin with an amino group added, would be amoxicillin and ampicillin, with or without clavulanic acid or sulbactam. I'm going to explain what those do in a later video. And you can get information about these. Let's open amoxicillin, for example. You can open this up and you can see all kinds of usage and dosing information. We can click on our contents here and find adult dosing, pediatric dosing, renal adjustment based on how the kidneys are handling it, hepatic adjustment based on how the livers are handling it, adverse effects. We're going to talk in a later video about the antimicrobial spectrum. Pharmacology refers to how well it gets distributed through the human body, and any major drug interactions. Your patient's on eight different drugs already, medicines already. You want to make sure that your amoxicillin's not going to have some counter indication, some interaction. So you got a whole lot of information here, which is really, really handy. You can also see which microbes here, the antimicrobial spectrum, that it's going to be good against, and so on. Okay, so let's go back to our first list of antibacterial agents. It's going to be important for you to get comfortable with most of these categories, and I'm going to talk about these in a later slide, how to wrap your brain around these different classes and the ways that the antibiotics in these different classes work. Okay, let's go back now to our PowerPoint and wrap up this particular lesson. So to summarize what we just talked about, different antimicrobial agents are used for different types of pathogens, and you should get familiar with those different categories, because the antibiotics or the antimicrobials within one particular category typically are not going to be useful for pathogens that fall into one of the other categories. The Sanford guide is used most commonly to guide our decisions regarding antimicrobial chemotherapy. And then it's important for you to remember that antibiotics are specifically antibacterial agents. Make sure that's real clear to you, and as an educator of your patients, make sure your patients understand that. So if you have reason to believe they have, for example, a viral infection and they're wondering why you're not giving them penicillin, you can explain to them why penicillin's not going to work for the common cold. So that's as far as we're going to go on this particular video, but please watch the others, because there are a few others that we need to talk about as we get into the details of antibiotics. And then there's a series following this series that's multi-part, looking at antibiotic resistance and how it is that the bacteria can resist the antibiotics that we try to kill them with.